Hi guys, Dr. Mandi here from German Chiropractic. Today we're going to go over how to do a self-abdominal massage for pregnancy. So one of my colleagues, Dr. Michelle Gurley, is actually who taught me this. I went to one of her classes and then watched a couple of her videos, and this is what she kind of teaches. It's what I teach a lot of my patients. So what you're going to do is first, very safely, get down onto your back. So we're going to lay down here, and you're going to lay onto your back here with a little bit of propped up. So I'm currently 34 weeks pregnant, so I had to wait a little bit so you could see everything I'm doing with my belly size. So we're gonna pull it up here. So what we're gonna go over, there's gonna be 4 parts on each side of the belly that you're gonna do. Personally, I do this every night. I usually use coconut oil on my belly for stretch marks, and then I do this right after. So the first one, and is more common to cause you pain, is actually going to be your round ligament. So your round ligament is gonna attach to your pelvis down here and then go up both sides of your uterus. So prior to pregnancy, it's only 3 centimeters long, so it's very tiny. Full term is closer to 18. So usually when baby goes through a big growth spurt is when you notice some pain, tightness, and pulling. So in order to find where it attaches down below to your pelvis, you're gonna go to your belly button, go to this bony part of your hip over here. From your belly button, you come 45 degrees down. From that bony part, 45 degrees down. And that's roughly where it should be. So you kind of poke around in there. So you want to essentially feel for some squishy parts, because that's going to be more fat and muscle. If you feel a little bit of resistance and kind of like a ropey-like feeling, that's going to be your round ligament. So what you're going to do is just do a little gentle pressure and do circles. And then you're going to follow it up on both sides of the belly. Sometimes one side's tighter than the other, sometimes it's not. What you want to look for is like a tightness feeling or a tenderness feeling. If you do, you just want to spend a little bit of extra time there. And it usually ends roughly about the line of the belly button. So then you do both sides and work your way up. So the next part is going to be what we call our oblique muscles. So they kind of start near your rib cage here and kind of go at a downward angle. So you're going to start on the side, same thing, just kind of do gentle pressure in a circle pattern, and you want to look for some tightness and tenderness again. Now I don't want you to sit here and kind of shove your fingers in, but a little bit of pressure, if you're farther along and you feel baby, it's not going to hurt baby. There's plenty of support in there for them. Good. The next part is going to be actually under your rib cage here. So you're going to go where your ribs kind of make that upside down V, and you're going to push one side at a time. So again, you're feeling for some tightness, tenderness, and then again, just do some gentle pressure. You can either do gentle circles, you can take the side of your hand, kind of drag down. Sometimes working on this area can help a little bit of like reflux and heartburn. Not always, but it can. But massaging in there is very important, especially once babies head down and kicking up here a lot, they can cause a lot of tension. So nice massage in there. And the last part we work on is what we call your rectus abdominis. So this is going to be your 6-pack abs through here. So what you want to do is find your belly button, and you're going to go out just a little bit to each side and then kind of move up and work up and down in this area. Now this is the muscle that tends to do split and give you a little bit of diastasis recti, so we want to kind of keep this as loose as we can. But again, just very gently. Now if you are suffering from something like pubic bone pain or anything like that, I would definitely concentrate on the lower part of your belly. And especially the farther along you are, you want to concentrate down here as your belly gets heavier. It's a lot more weight down here. So like I said, I do this to myself every night, sometimes during the day if I feel particularly tight, but that's how you give yourself a self belly massage.